The next step in the study, now that we've sort of established feasibility and satisfaction, would be to test it in a randomized controlled trial that's powered to detect differences in outcomes. And I think once you prove or can show that there is an impact in outcomes, then getting support to support the financial incentive piece is more effective. So I think that we would probably have to investigate the findings in a larger group before scaling it, but this is certainly the first step in doing that. Like many things, it can be a blessing and a curse. And I think what my aim to do in my research in general, and certainly with my collaborators in this project, was to really tip the scales towards utilizing technology for healthy behavior. So I think two aspects of the way this study that we're set up that highlight the positive aspects of technology. One are that the team and peer support aspect. So, the participants were in teams with other participants with type 1 diabetes and elevated cardiovascular risk, and they were completing these challenges together. And I think connectivity and peer support is certainly a huge advantage, especially these days, of technology for sure. And then secondly, I think it's important to integrate the technology with real activity. So the Pacer app is a really good example of that. The participants actually physically walked, and the phone actually physically picked up how many steps they were taking. And I know a lot of other apps have that feature as well. And so that's, I think, instead of the more active use of technology as opposed to the passive use of technology, is something that we as providers and health educators can certainly sort of optimize the use of. This was just like the care of patients with diabetes in general. This was definitely a team effort. These studies are large undertakings, and they take a lot of cooperation between the actual study team, the participants, and the clinicians that help us speak to participants and recruit them. So I think that would be my biggest message, that we really all have to work together to help this vulnerable group reduce their complications in the long term.